This is a continuation of the primary healthcare services. So we're going to look at the rehabilitative care or rehabilitation. Rehabilitation is a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment. Health conditions includes disease like acute or chronic, disorders, injuries, or trauma. A health condition may also include other circumstances such as pregnancy, aging, stress, congenital anomaly, or genetic predisposition. Environments refers to the physical, social, and cultural context in which individuals and their communities live. Rehabilitation may be needed by anyone with a health condition who experiences difficulty in mobility, vision, hearing, speech, swallow, or cognition. For example, rehabilitation addresses impairment, activity limitation, and participation restriction, as well as personal and environmental factors, including assistive technology that impact on functioning. Rehabilitation is a highly person-centered health strategy which with intervention focusing on the function and capacities of an individual as well as the goal and preferences of the user. Rehabilitation usually includes the interventions provided by rehabilitation professionals such as physiotherapists, occupational therapists, speech and language therapists, psychologists, and physical and rehabilitation medicine doctors. Primary health care is where the diagnosis of a large majority of health conditions, the identification of problems in functioning, and referral to other services delivery platform need to occur. It is also the care platform where adherence to treatment plans and their progress take place. Rehabilitation provides close to people's home, enables them to remain in education and in the workforce and remain independent or minimize care and financial support for longer, leading to associated cost benefit for both the individual and society. In addition, by helping to mitigate the risk of preventable complications and secondary conditions, rehabilitation at the primary care level can also help to avoid costly hospitalization and readmission. So we have seen that if we can incorporate rehabilitation services to PHC centers, it could be of great importance to the individual and also to the society. The greatest advantage is the cost reduction, because we have seen that in rehabilitation care, individuals are given assisted services. So these are the persons who have difficulty or who have some conditions and they need some help to ensure that they continue maybe moving, they can see, they can hear, they can have some speech, they can swallow. Basically, rehabilitation enables people to have some conditions or health problems, maybe to try to cope up with their condition. Then you also have the supportive or palliative care. Physical, emotional, and spiritual burdens can negatively affect quality of life for patients and families facing serious diseases. Because if you can remember in the definition of health, we said it's a state of complete physical, mental, and social well-being. Even spiritual part is supposed to is a part of the health. Supportive care is specialized medicine care for people with serious illness. This type of care is focused on providing patients with relief from symptoms, pain, and stress of serious illness. The goal is to improve quality of life for both the patients and the family. So during the palliative care, these mainly are the patients who are in their terminal stage. So they have terminal diseases. That means it is somewhat impossible to treat their condition. So they are being given services just to relieve them from the symptoms, just to make them not to feel pain, or maybe to have stress, and maybe just basically to improve their quality of life. Examples of conditions that may benefit from supportive care consultation include the following: congestive heart failure or the cardiovascular disease, chronic obstructive pulmonary disease, cancer, liver disease, cirrhosis, stroke, dementia, neurologic disease, and kidney failure. Supportive care is usually delivered by supportive care team comprised of palliative care trained physician, nurse, practitioner, social worker, and medical center chaplain who provide specialized expertise and an interdisciplinary approach to symptom management and coordination of care. So that is it. Then our last care under the PHC is called the promotive care. The World Health Organization definition of health promotion is the process of enabling people to increase control over and to improve their health. Health promotion and disease prevention programs focus on keeping people healthy. Health promotion programs aims to engage and empower individuals and communities to choose healthy behavior and make change that reduce the risk of developing chronic diseases and other morbidities. Disease preventions differ from health promotion because it focuses on specific efforts aimed at reducing the development of and severity of chronic diseases and other morbidities. So in health promotion, it focuses on specific effort. What can you do in order to prevent or reduce the severity of a disease? Health promotion and disease prevention programs often address social determinants of health, which influences modifiable risk factors. Social determinants of health are the economic, social, cultural, and political conditions in which people are born, grow, and live that affect health status. Modifiable risk behaviors include example: tobacco use, poor eating habits, and lack of physical activity, which contributes to the development of chronic diseases. Typical activities for health promotions, disease preventions, and wellness program include communication, that is raising awareness about healthy behaviors for the general public. Examples of communication strategies include public service announcement, health fairs, mass media campaigns, and newsletters. There's also education, empowering behavior change and action through increased knowledge. Examples of health education strategies include courses, training, and support groups. And lastly is the policy system and environment, that is making systematic changes through improved laws, rules, and regulations, which are the policies. Functional organizational components such as these are the systems, and economic, social, or physical environment to encourage and make available and enable healthy choices.